Good afternoon. Today is the Thursday, the 8th of April, 2021, here at the CCSA. So we're here for you actually off the schedule on a special appearance Thursday, because usually we have the press briefing on Monday, Wednesday, and Friday. But as per the order of the director of the CCSA, we're here to communicate with you, looking ahead of what's going to happen in the month of April, and of course with the current situation now. So this warrants our coming to speak to the public. Now just mind you that we do all of this because of our sincere intention to communicate and provide you with the most updated information. There may be some people who may disagree with the approach or have a lot of suggestions and comments, but nevertheless we are doing this all for the general public, both the Thai public and the English language audience and those living in Thailand, those calling Thailand home. We're doing this for you as well as your families so that all of us can be safe and sound. Now, thank you first to Dr. Tui Sin for the Thai language summary that we had just now. This morning there was the EOC, or Emergency Operations Center of the CCSA. They held their meeting at the Ministry of Public Health. Now, of course, this was regarding the current situation wherein small various clusters have appeared in Bangkok and its vicinity, particularly from the entertainment venues and most likely from the UK variant strain. Now, this meeting also agreed on certain approaches that we will be making throughout the month of April, which I'll go to that in due course. The population that is actually most affected by these new clusters from the entertainment venues are actually the younger population, who are in the working age actually, so perhaps the early 20s to the early 30s, those in the working level. In Bangkok, in Chiang Mai, and in Chiang Rai, and various major provinces, but many of this is concentrated in the entertainment areas in Bangkok. Now, just now, Dr. Tui Sin showed us a map of the Thong Lor area, the Thong Lor district in Bangkok, wherein the various bars and entertainment venues were highlighted on that map. We can have that on screen for you, just for you to see. Yes, so these are some of the entertainment venues which were affected by the cluster. So it is very, very important for us to be very cautious this today and in the coming weeks not to visit entertainment areas which are congested, particularly those who have found already various positive cases, like the ones shown on screen in Bangkok. That's a Google map for you to see. Now, outside Bangkok as well, outside Thong Lor district, around 21 pubs and bars in 8 districts in Bangkok, aside from in Thong Lor district, in 8 districts, 21 bars have also been affected. And what we will be doing in those areas will be strengthened active case finding to root out the various cases that still remain. Now, moving to the general situation and number of cases that we have for today, and we'll have a slide coming up for you soon. Today we have confirmed case numbering up to 405. Now, that's actually I would say, whopping number to look at compared to the other days. So this mostly, from this number of 405, the majority comes from active case finding from the entertainment venues. And you have on screen for you the active case now. In the past weeks, it had been 1,000 plus active cases currently under treatment, now stands at 2,114, as you can see on screen. Also, cumulative number of cases since the very beginning last year, we have now surpassed 30,000 cases, 30K. So this is actually the first time we're surpassing 30K cumulative cases. But of course, with minus the recoveries, 28,000 plus that you see on screen, and no further fatalities. Happy to report that for today. Now, I mentioned that the director of the CCSA had asked us to come to speak to the audience today on Thursday, but we'll still be having the briefings on Monday, Wednesday, and Friday. During the Songkran holiday, we'll look at the situation first on how much information is needed to communicate to the audience during Songkran, but because of course we would like you to enjoy Songkran holiday in the most appropriate way in the context of the situation that we have right now in Thailand. Now, the director of the CCSA, which is the Prime Minister as head of the CCSA, is very concerned for the health and well-being of everyone in light of this situation. So he delivered a message, and in that message it included things such as that the control measures would be gradually stepped up according to the situation, the prevailing situation that we have in each area and in each period, as well as the nature of each activity. It would depend on that. The public is still encouraged to take all precautionary measures to prevent the spread and the contracting of the virus. So cooperation from all sectors of society remains very, very important for safeguarding the public health and as well as ensuring that economic activities will not be disrupted or disrupted in a minimum sense. Now, given the ongoing prospects that the new cases are continuously being found in entertainment venues, the CCSA is considering the temporary closure of entertainment venues in 41 provinces. Now, that's a high number of provinces, more than half of the country, half of the country's provinces. So we're considering that for entertainment venues in 41 provinces. But this will not include restaurants, which will be considered on a case-by-case basis. This is still to be confirmed. This is still to be considered. And as soon as we finalize this, an order will be released and will be announced also by various agencies, such as the Department of Disease Control. Now, this blanket closure of entertainment venues will not include restaurants, I'd like to stress, will not include restaurants, since doing so will affect larger circles of people. We'll be focusing on entertainment venues, bars and pubs. The temporary closure of restaurants, in the case that if a COVID case is reported, that will be considered on a case-by-case basis and a zone-by-zone basis. And meanwhile, all restaurants are advised to strengthen their control measures, their COVID prevention measures. The UK variant of COVID recently detected in Thailand has spread much quicker than expected, than the normal strain. And therefore, it is still strongly recommended that people take extra precaution. Those who have visited risk areas should refrain from visiting elderly people, especially during Songkran. And I'll talk a little bit more in my summary. So just that the CCSA recommends that all agencies consider as well to work from home until the month of April, as well as private companies, cooperation is also requested. So in summary, I'll just summarize some basic general points that I highlighted today in around 4 points. So firstly, on the consideration of the CCSA of the proposal by various provinces, the categorization of provinces will not change. So the color coding system of the provinces, as we reported yesterday, as proposed by different provinces, having a new, some 5 Bangkok plus 4 provinces in the red zone, that will not be officially considered as a new categorization. The rationale is because this will be affecting the management as well as affecting the travel between provinces and the management that CCSA has to maintain. So the categorization would remain the same. The 5 provinces will not be considered as red provinces. Secondly, the approach as we reach the middle of the month of April until the end of April, the approach for April. So as proposed by the Ministry of Public Health, 41 provinces are proposed to close entertainment venues for 14 days, and that active case finding will be strengthened in these 41 provinces. Now, this may be a new measure, but it is still a proposal by the Ministry of Public Health, and this will be considered by the CCSA in due course. Now, as per the analysis that we have, the new clusters that we have right now, it's quite similar to the UK strain. It spreads very, very quickly. So we have to be very, very careful. So in terms of looking forward towards April, we hope that all the business establishments and all the entertainment venues will increase their strict measures tenfold. So number 3, the work from home scheme has been conveyed to various government agencies that they have to start arranging for work from home scheme in the month of April as appropriate. As for the private sector, private companies, we are announcing that they should be considering the work from home scheme for their employees as appropriate as much as possible. So fourthly, we encourage the general public to provide us with the maximum cooperation as possible. Now, this is key to all the measures and proposals that we have been talking about. If we have all these new proposals, either categorization of provinces or not, the proposal for in the month of April to close entertainment venues, the stronger active case finding and the like, and all of these measures will not be useful if the general public do not provide us with cooperation. So this is key. Now, fifth and lastly is about for our approach in April. Fifth point is about Songkran, which we mentioned yesterday. This is about taking extra precaution even if seeking blessings from the elderly is allowed. As you recall, we allow the celebration of Songkran in the traditional sense, meaning seeking blessings from the elderly, your parents or grandparents, or if you are foreign nationals and you have Thai families, people, of course, traditionally in Thailand go to their parents or grandparents to seek blessings and pour holy water on the palms of the elderly and receive blessings. So that is allowed in the traditional sense, but still we have to be extra careful because there have been news reports of young people in different families visiting parents and actually contracting COVID to the elderly, who are, of course, they have less immunity. So that's allowed, but to be extra careful. And what is not allowed, as I recapped yesterday, is water splashing, as well as partying during Songkran in congested areas, crowded areas, such as what has been done in the past years, not last year, but perhaps 2 years ago and 3 years and from then on. So that's not allowed, water splashing and parties in congested areas, as well as foam parties as well. Foam parties, if you live in Thailand, you would know that in various celebrations like Songkran, there are some entertainment venues that conduct foam parties. So these are around 4 or 5 points regarding the approach that we will be taking in the month of April for you, recapped for you. So hoping that you'll take these issues very seriously. We hope that the new surge, the new clusters will not spread. We hope to contain them within the month of April, and that Songkran will not exacerbate or spread the virus even more. So hoping for the best in the month of April for all of you here, those who call Thailand home, those foreign citizens, the English-speaking audience, as well as those viewing this briefing on social media from around the world. So this is all I have for today. Thank you very much for your kind attention. We'll see you again tomorrow on Friday for the English language briefing of the CCSA following the Thai language briefing. Thank you and สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพานุ